Deputy Director General of the Department of Communicable Diseases Control under the Ministry of Health, Dr. Sisavath Soutthaniraxay, told a press conference on Thursday, June 10th, that the Pfizer vaccine will be given to 50,300 people over the age of 60 and with underlying health conditions.
สำหรับการซักวัคซีนที่มาใหม่นี้เพิ่นก็มีขาดหมายที่ทางศูนย์สื่อสารการแพทย์ก็ได้แถลงไปแล้ว
Healthcare workers in Vientiane will begin administering the first dose of the Pfizer COVID-19 vaccine to target groups starting on June 15. The move is part of the government efforts to expedite the vaccination program and immunize 3.7 million people, or 57% of the total population by the end of this year.
แต่กลุ่มอายุก็แม่นเป้าหมายก็แม่น60 ปีขึ้นไปผู้ที่มีพยาธิประจำตัว
According to Dr. Sisavath Soutthaniraxay, other priority groups are government officials, medical staff, those who work in border areas, and people who regularly cross the border. First doses will be administered between June 15 and 30th, and second doses will be given 21 to 28 days later. The government has decided to firstly arrange the rollout of the Pfizer vaccine in the capital because this type of vaccine requires freezers capable of storing it at -80 degrees Celsius. A shipment of 100,620 doses of the vaccine arrived in Laos last week, provided by the COVAX facility, a partnership between the Coalition for Epidemic Preparedness, Innovations, Gavi, the Vaccine Alliance, UNICEF, and the World Health Organization, or WHO.
ปัจจุบันนี้พวกเฮากำลังซักวัคซีนเข็มที่2ในขอบเขตทั่วประเทศถ้าท่านซักวัคซีนแอสตราเซเนกาเข็มที่1ได้ฮอด8อาทิตย์แล้วท่านสามารถได้ไปรับเข็มที่2ได้
Dr. Sisavath said if the target groups receive 2 doses of the vaccine, it will help cut the chain of infection. Countries with a high vaccination rate have started to ease travel restrictions. The government has instructed the Ministry of Health to speed up the vaccination drive to prevent the virus from spreading. The AstraZeneca, Sputnik V, and Sinopharm vaccines are currently being administered.
ตรวจพบผู้ติดเชื้อทั้งหมดมัน4กรณีจากนครหลวงเวียงจันทร์2กรณีและจำปาสัก2กรณี
According to Dr. Sisavath, Laos is struggling to contain the COVID-19 community outbreak, which erupted in mid-April. 4 new cases were reported on Tuesday, bringing the total to 1,975. 2 of the cases were recorded in Vientiane and 2 in Champasak. More than 1,800 people have been discharged from hospitals.
ต่อสภาพการดังกล่าวนี้ห้องว่าการสำนักงานนายกเพิ่นก็จะได้ออกแจ้งการฉบับเลขที่595ลงวันที่4มิถุนายนเกี่ยวกับการสืบต่อปฏิบัติมาตรการป้องกันควบคุมและสกัดกั้นการระบาดของพยาธิโควิด -19 อยู่ใน
Dr. Sisavath said that because of the continuing infections in Vientiane, the government on Friday, June 4th, extended the lockdown for another 15 days until June 19 under a new notice issued by the Prime Minister's office. Restrictions have been intensified in areas of infections known as red zones. At the same time, the government has eased some virus control measures to minimize the impacts on the economy and people's livelihoods.